Good evening, everybody. How are you all doing? I am happy to have been continuously doing one or the other live session, and today's live session is all about PCOD, thyroid care and management. And Dr. Akshat, who calls himself a doctor with a twist, is joining us today in this session. And PCOD, thyroid care, management, prevention, these are certain questions which we all very often get on our page, and we have bought a right person today to join us in this session to answer you, and hearing it from a doctor himself makes a lot of difference, isn't it? So people, please join in. Doctor has sent in a request. I'm adding in here. My name is Kavitha. I'm founder of Tots and Moms, and I'm very excited to have this session today, which really is going to be helpful for one and all. So let's continue, and I am adding Dr. Akshat here right now. Good evening, doctor. How are you doing?
Hi, good evening, Kavitha. Can you hear me, see me?
Yes, very well, very well. Tell us about yourself and what you do. Our people are eager to know.
Okay, so I'm typically an allopath. I've done my MBBS, but I've been practicing something called as lifestyle medicine. So it's been a long journey. Both my parents are doctors. My aunts, my uncles, my grandparents have been doctors.
Now we have our questions listed down. We have also shared it with you. I will start with our questions for the day. So first
Yeah.
question, possible causes for thyroid. We are talking about thyroid, a little brief about it, and then if you can answer this question would be great, doctor.
Okay. So thyroid is basically a butterfly-shaped gland at the base of the neck, the nape of the neck, and it produces two hormones, that is T3 and T4. The TSH hormone, the thyroid stimulating hormone, is actually produced in the pituitary, which is a gland in the brain. This kind of stimulates the thyroid to produce the T3, T4. Okay. So when the TSH goes up higher and higher and higher, the T4, T3 starts coming lower and lower. That kind of condition becomes a hypothyroidism. When the opposite happens, it is hyperthyroidism. Okay. But what you asked is the cause, right? Why does it happen? So it's very difficult to define a cause. But if you think about the olden times, initially it used to be iodine deficiency was the commonest cause. But of course, the fortification of white salt with the iodine really helped a lot. And that kind of reason has been eradicated, almost eradicated. Of course, now with, the different types of salts coming in, I do worry, if they don't have enough iodine, what we might expect in the next 5, 6 years. But that remains to be answered. Now, if you look at the cause, it's more of autoimmune thyroid, that is the Hashimoto's, the way we call it. That somehow has become a very common cause of the hypothyroidism. That is what we are looking at. Of course, there are other reasons like family history plays a major role. If so predominantly females are predisposed. So if your mom has it, then the daughter can have it. Of course, if the mom or dad have it, the son can also have it. But it is found to be more common in females. So family history plays a major role. Then third is, I think, pregnancy. Sometimes thyroid can kind of come up out of the blue during pregnancy. If you have family history, you should anyway be careful. But sometimes it can happen without a family history also. Now it can go away also after pregnancy. So again, that it depends from case to case. But these are predominantly major causes. Then there are things like some medications like lithium is there, and there are, suppose you have the hyperthyroid. So treatment of hypothyroid, which is, you have like radioactive iodine is there, or there are some surgeries which you have to go through, especially post-operative, like a thyroid surgery or something. Then you will get pushed into hypothyroidism. So these predominantly are the causes. One, cause which is in the gray area is a very poor, chronically very poor lifestyle. Not that you're leading a little bit poor lifestyle for few hours in the day or a few days and in the month or something. But if you're chronically not taking care of yourself, your weight is going up, and no time to sleep, or wake sleeping hours, wake eating patterns, no exercise, then there's a chance that it can load up the thyroid, because the thyroid is a metabolic gland. It not only controls the metabolism, but your heart rate, your temperature, it does a lot. So if that something like that is irritating the thyroid gland, then there can be an increase in the TSH, which can push you into hypothyroidism. Now, whether you need medication in these scenarios or not is a different ballgame. I can't get into that. But if your report is coming back, which is on the border, then it makes sense to correct your lifestyle before you jump into any form of medication. Now, when I say border, I mean border. So if you are, see, normally we say TSH is about 0.5 to 5. So probably if you're 6, 7, 8, makes sense to maybe, of course, consult your doctor or a specialist, and don't do it alone. But consult someone and then probably retest in about a month or 2 months and see if the thyroid has come down or not.
Thank you for answering that. After this, I think I should take up Sejal Yoga's question. She's asking what are the thyroid symptoms, which is not in our list but definitely needed. How will we know that this is a symptom of thyroid and I need to visit doctor?
So it's unfortunately thyroid is the symptoms are very vague. You can have fatigue, tiredness, weakness, which can happen because of things like vitamin D deficiency, which could be someone who's not happy with what's happening in their life, someone who's a multitasker could feel the same symptoms. Then you have lethargy. A lot of people complain, I don't feel like getting up in the morning, all that. Intolerance to cold, intolerance to heat.
Sudden change,
बहुत ठंडी लग रही है, बहुत गर्मी लग रही है.
somebody who was active and now feels like that. Is it what you mean? Somebody who was
Yeah,
active.
I mean, it can be sudden. It can be. You see, the problem is with people, something or the other might be happening. Even when you're feeling a little unwell, so something might be happening, and then you feel like now suddenly I'm feeling this way. But it might be happening for a longer period of time. It's very difficult to define when they feel it. I mean, symptoms are so vague. So that is what. Like then you talk about hair fall, and then unexplained weight loss, unexplained weight gain. So hyper and hypo, you can talk about unexplained. That if you say, okay, fine, that can be a symptom of thyroid also, or difficulty in conception. You're trying to conceive, you're trying to get pregnant, you're not able to get pregnant. Makes sense to check the thyroid. But unfortunately, it's very difficult to say these are all symptoms of thyroid. Constipation is a symptom of hypothyroidism. Any of these. So just because I've said something, you should not start thinking that, oh, I have thyroid. No, that's exactly what I'm trying to say. Of course, if you've not checked the thyroid in a year, in 2 years, of course it makes sense to check the thyroid. But don't start manifesting like, oh, Dr. Akshat said I constipation. It's a symptom, so it looks like I have thyroid. So it doesn't work like that because unfortunately thyroid has very vague symptoms. Now, of course, if you feel there's a swelling in the neck, suppose it is of course worthwhile getting it checked out. Now that you told about test, how often can we get this thyroid tested? You now say how often what is the frequency that we need to get it checked? One is you have thyroid problems, you are on medication, okay, or you are on the border of thyroid and you're making some changes and all. That is the time where you have to check the T3, T4, TSH at least once in 3 months. That means
if not somebody is not just like I was being asked to get it tested, is it necessary to get it? So
suppose you have family history of thyroid, and you feel there are symptoms, then it makes sense to get it checked that time. So that could be once in 4 months, once in 6 months. Suppose you have family history of thyroid, but you are fine, there's no problem, then maybe once in a year when you're doing like an annual checkup, that is okay. If there's no family history, you are feeling fine, you're leading a good lifestyle, your weight is not up and down, your temperature is fine, your heart rate is fine, your cholesterol is fine, your gut is fine, once in maybe 2 years is okay. I think partially I've answered types of thyroid. Would you like to clarify? But we can. I mean, so one is hypothyroidism, what we said, and one is hyperthyroidism. Then what is the second? I mean, it's not another type, but when you say that hypothyroidism is autoimmune, that is Hashimoto's. So that becomes another type of thyroid. And when it is hyperthyroidism, which is autoimmune, then you talk about Graves' disease. So technically, these are 4 types of thyroid. And then you have something called as, of course, the goiter is there, which can be euthyroid, which means the thyroid is normal, but there's a swelling in the thyroid. Or you could have a normal goiter with a thyroid problem. Or you have something called as thyroiditis. Now, thyroiditis is a very non-specific condition, which is basically, itis means inflammation. So, inflammation of the thyroid, why it happens, it could be a viral, it could be an infection, but it can come for a period of time. You will need some medication. It will pass off, but these are the basic types of thyroid. Okay, I'm taking up the next question. This is to generic people because there are very wide variety of types of thyroid that doctor is only explaining. But in general, I am asking this question: foods that should be avoided while one is suffering from thyroid. So honestly, the answer is you don't have to avoid anything. You're free to eat everything. So normally, what are the myths? I call it the myths. So one is cruciferous vegetables. Let's clear this out. You can have cruciferous vegetables, that's cabbage, cauliflower, broccoli and all of that. The only condition is that you can cook it. cook it nicely. Even if you're having it in a salad, you should saute it or blanch it and then have it. Okay. Second is you can have bajra, you can have peanuts, you can have soy, but I wouldn't recommend having it like twice a week, thrice a week. No, I would say probably once a week, once in 10 days is good enough. You don't have to keep having it again and again. But I do recommend white iodized salt. So if people have removed the white iodized salt and put pink and green and white and blue, so many types of salts are there. It's a little risky that it's a little risk that you're taking. So if someone loves the other types of salt, what I normally recommend is you mix the pink and the white salt in equal quantities. 50-50, mix it and then use the mixture for at least for cooking. Talk about hypothyroidism. You're trying to boost the activity, right? So you have zinc, the foods that are rich in zinc, magnesium, selenium, iodine. Iodine is from the salt, of course. These are the things which are very good to boost the activity of the thyroid gland. So pumpkin seeds, you can have probably wheatgrass powder is good. You can have Brazil nut is there if you can afford it. It's a little expensive, but it's good. But having these things, people talk a lot about coconut oil for thyroid also. But I do have a little caution with coconut oil that make sure the overall oil intake is not too much. If your overall oil intake is already too much in the food and on top of that you're having coconut oil, then you're headed for different type of trouble. So you might be like, my thyroid is doing good, but then other issues are happening, so it's not worth it. So understanding the total oil intake and then on top of that adding it is okay, or cooking in coconut oil for a bit, that's also okay. For thyroid patients, I always say, have your at least one or two fruits, have enough salads, have your sauté vegetables, eat vegetables in your diet because that is something that will help you, and iron rich foods. If you are anemic and you have thyroid, then the anemia can worsen the thyroid. So make sure you have enough iron rich foods and vitamin C rich foods in your meal every day.
Thank you so much, doctor. The next question is thyroid reversible? There are so many articles, blogs coming in, and so many people talking about it. We would like to hear from you.
So let's put it like this. We're talking about hypothyroidism and the autoimmune hypothyroidism. Hyperthyroidism is a different, very complicated ball game. So I don't want to get into that now because hyperthyroidism suddenly can come and it can go away also. Or mostly the treatment of hyper can push the patient into hypo. So that is separate. But hypothyroidism, which is common, and Hashimoto's, which is the autoimmune version. So what I have noticed is, if you ask me, is it reversible? It can be reversible. I will not make a blanket statement that it is reversible. I always tell people that start finding out if your thyroid is reversible. What is happening outside the world, testimonials and all is different. We don't know what has happened. And in my private, exactly. And half the times, I will tell you this, people are getting off medication because they were never supposed to be started on medication. They shouldn't have been on medication. That is why people like me are able to remove that medication. But a typical case of Hashimoto's, which is the more severe kind of thyroid, in my practice, very personally also, if I tell you, it is only 1% of my patients who are off medication. And that also I am sitting and monitoring them with like microscopically making sure that the TSH doesn't go running back up. And it's a sincere request to any person listening to this, don't stop or start medications by yourself. I have patients who have stopped thyroid medication suddenly, come back with a TSH of 500, TSH of 100 when it is supposed to be under 5. So it can have really drastic repercussions just because you heard someone talk about it. So don't do that. There are a lot of experts out there who are ready to help you. So please be under the guidance of someone.
The last question we have noted down is, what are the lifestyle changes that can be made which will be helpful in preventing or managing thyroid?
So one, what we said is food. We've kind of understood nutrition plays a major role, but it is not only what you eat. It is when you eat, how you eat, why you eat, are you bored, comfort food, sugary foods. So there are a lot of things which all start here. If we understand what's happening in the, this complicated, this much area of ours, then only it becomes easy to control the body. Because I very strongly believe in exercise. If I'm talking about boosting someone's metabolism, it's very difficult to do it only with food. You need exercise, you need movement. Sitting has to reduce. If you're going to be sitting for 8, 9 hours in the day and you're just doing half an hour exercise, even that's not enough. But a lot of times when you speak to a thyroid patient also, why are you not exercising? You know it, you know you have to exercise. Why are you not doing it? Doctors are man nahi karta hai. I don't feel like exercising. Where is that feeling coming from? It's coming from here, right? Why? I mean, why would you purposely not take care of yourself? So eventually, when you talk about lifestyle, there's something happening in the day that is preventing this person from going for a walk. That is we know yoga is very good for thyroid. No one purposely doesn't want to take care of themselves, right? They know what needs to be done. But it is just that there is something in the day which prevents it, which doesn't allow them. Of course, it starts here. It starts with a lot of prioritizing. And that is what is here. And that is what is important from my perspective, that why are you not doing what you're supposed to do? So if I am able to enable a person to understand the why are you not sleeping for 7 hours in the night? Why are you sleeping at 4 in the morning? Why are you taking so much stress? What is it that stresses you out? So if these things, the whys can be answered, then only the person can go on a healthy lifestyle which is sustainable. Now, this sustainable word is very important. We have a lot of experts, we have a lot of people doing a lot of things which does give results. The TSH can come down, the medication can come down. But what happens is if that's not sustainable, then everything goes out of the window. Plus, people feel deprived when things like programs are over, they don't know what to do, they have not learned anything. So if anybody is doing anything in lifestyle, please make sure that you are understanding why you are doing what you are doing and how it is helping you, whether it is exercising, whether it is food, whether it is sleep, whether it is stress, whatever it is. One more point with the lifestyle is deficiencies. I spoke about anemia, but there are two more things which are very important. One is vitamin D deficiency, and second is vitamin B12 deficiency. So you've corrected everything, but if you forget D and B12, they are two most important part of a puzzle. So whatever you're dealing with, please make sure that vitamin D and B12 are correct.
Doctor, I'm taking questions from people now. Charming Desert Rose has asked, can obesity cause thyroid?
See, that's what I said, right? Now, when you say obesity, that means your weight has really, really gone up. Okay, now, is that weight causing a metabolic load? Maybe. It can push the TSH to go up. Or is it the TSH which is pushing the weight to go up? So, the question is, can it cause? Yes, it can push the thyroid into hypothyroidism. Is that reversible? Probably if the weight comes down, then probably the TSH will come down also. But again, case to case, a lot of differentials have to be monitored.
Dr. Durgesh Kodnani has asked, can just regular walks reduce the hormonal imbalances in the body? Or should one follow a fitness regime altogether?
So I believe that a combination of cardio, that's your walks, and some amount of muscle training. Now, whether it's yoga, a little bit of Pilates, lightweight training also, whatever you are able to do is actually beautiful. It's a beautiful combination to handle thyroid, hormonal imbalances, whatever you want to deal with. Okay. But for some reason, you're not able to handle the muscular part yet. Of course, you start with your walks, build on your walks. Suppose you're doing 30 minutes, that's okay. Try to walk a little faster. Can you go into a little bit of jogging? So try to give yourself a little bit of challenge, a little bit of variation. Obviously, don't keep doing a walk, 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 walk. Give a little walk. There's something called as interval walking. You walk slow for 2 minutes, walk fast for 1 minute, then walk slow for 3 minutes, walk faster for 2 minutes. All these variations, if you start doing, then only you are going to give yourself that required push.
I am enchanted, Bunny. From this ID, I get a question. I really enjoy your videos, doctor. I have one question. Is pain in heels after a night's sleep a normal symptom of hypothyroidism? There are so many people asking this question, so please
Sorry,
tell us.
what is it? What is the symptom?
Is pain in heels after a night's sleep a normal symptom of hypothyroidism?
Not really. Not really. That is more likely to be a vitamin D deficiency, one. Second is too much walking the previous 2 days, especially if your footwear was not right. That is more likely. And the worst case scenario is that you're going into something called as plantar fasciitis. So you need to be extra careful. I wouldn't really blame the thyroid for this. Pain in the heels.
There is another question from I am Enchanted Bunny. I got to know using aluminium cookware and using refined oil causes thyroid disorders.
I wouldn't say it causes thyroid disorders, but it is a good idea to change from refined to unrefined or to cold pressed. And aluminium, we have always known that it has to be minimum usage. Suppose,
Exactly.
like in my house also, we have a very big aluminium donga, which is only used where we are cooking for maybe 10, 15 people. So it
Okay.
is obviously recommended that you don't use aluminium regularly. Once in 6 months, maybe is okay. 3 months is okay. And refined oils, we have all accepted it that we cannot be using refined oils on an everyday basis at all. If cold press is too expensive, then you have unrefined oils, you have filtered oils also, which are doable, which are absolutely manageable. So I understand that cold press and all is expensive. So the midway is fine. But refined oils must go.
From the ID Fern 21, there is another question. What about drug related thyroid, like when taking amiodarone? I'm sorry, I cannot pronounce it well.
Amiodarone, yes, yes.
Yeah.
Yeah. So lithium, amiodarone, they can further push your TSH to increase, push you into hypothyroidism. So it's a catch-22 if you really need the medication. If you really need the medication, we can't do much about it. So you have to take the medication, and then whatever you can do in your lifestyle, take care of your lifestyle to keep the TSH where it is. If you can't take care of the lifestyle, plus you need to be on medication, then the TSH will mostly start going up, which will further put you onto the thyroid medication. So again, the choice remains in your hand. The choice does remain in the patient's hand to take care of themselves as much as possible. If you can get off the other medications, very good. Anyway, you're solving half the problem. If you can't get off, if you can't take care of your lifestyle, then a small thyroid pill will come.
Nora said, how do we ensure that we have adequate iodine in our diet?
If
And
you
one
have
question related to it, one person is asking, this white sugar or iodized sugar causes bloating. So is it true? Both the
iodized
questions.
sugar or iodized salt?
Oh, sorry, iodized salt.
An iodized salt first. So first part of the question is how do you ensure enough iodine in the food? Half a teaspoon of white iodized salt has enough iodine for 1 day. So even
Okay.
if you have, that's why I said if you mix it, problem is solved. If
Okay.
mixing is too complicated, then just stick to white iodized salt. So if that half is coming in your food, you have enough iodine. You don't have to sit and gulp seaweed and all those things. You don't need extra iodine at all. Okay. Second question is white iodized salt. Does it really cause bloating? I don't think so. Unless and until you message me and tell me that you have removed all the other causes of bloating, whether it is chewing slowly, sitting after meals, lying down after meals, you've taken a probiotic, you've been dewormed. There are so many causes, unfortunately, of bloating. So you remove all of that, and still, if you have bloating, then I might think about the white salt. Otherwise, I am not going to kind of say that white iodized salt is causing bloating.
Deepthi Arora is asking, is it difficult to lose weight for a thyroid patient? I see many of them coming to the same gym that I go and they face a lot of difficulty. Some of them are able to lose weight. Most of them complain that it is getting very difficult. And the stress, the pain, the other symptoms are causing a lot of stress in them. And they're
Which
unable to
prevents you to exercise. Yeah. So again, I've actually made a reel on this also where the problem is, yes, it can be a little 10% more difficult for someone with thyroid to lose hypothyroidism to lose weight. Okay. But now what the problem has become is that we come with a mindset of, listen, I have thyroid, I have hypothyroidism, I can't lose weight. You're not even exercising, you're not eating on time, you're not sleeping on time, you are not even drinking enough water, you are D deficient, you're B12 deficient, and your TSH is well under control. Well under control. Now, what I mean by well under control is it is nicely below 4. So why are we blaming the thyroid in this situation for not getting weight loss? Again, my request to everybody with hypothyroidism is that correct your lifestyle. If your TSH is well under control, don't blame your thyroid for the lack of weight loss. Okay, if you tell me my TSH is 8, my TSH is 15, my TSH is 30, okay, fine. I will say it is because of your thyroid. It is still underactive. It is not functioning properly. So your metabolism can be taking a dip. But you do everything else and the TSH comes down also, then I am telling you weight loss will happen. It can take longer. It can take a little longer, but it will happen. And please don't deprive yourself. If you stop eating, okay, initially you will have a little bit of weight loss because of the calorie restriction, but when you're doing it over a period of time, you will go into lower metabolism. So tomorrow, even if you don't eat anything, your weight will go up because your metabolism has dipped very badly. So don't tell me that you're not eating and still not losing weight. It doesn't work at all. So don't be deprived. Don't be drained. You're over tiring yourself, sleeping 4 hours. Try to correct these things. And I'm telling you, be patient. And the weight loss will happen. Even if the scale doesn't show it, you will feel it on yourself. Your clothes will fit better, inch loss will happen, your belly fat will go inside, because that is what is more important than that scale telling you, listen, this is your weight.
People are asking what is the right lifestyle that you recommend at the current era. I know it is easy to tell follow this, follow that, but this era has a lot of demands of its own to be financially doing
Independent,
good
fast.
and to be healthy and to also take care of people who are dependent on us. There is so much stress on each individual. Even that you want to do, there are so many restrictions. So you must have been dealing with such people day in, day out. So what is that ideal scenario one can have in a lifestyle change that we actually talk about, which can be, if not very easily, but
Yeah.
by putting a little effort, be followed?
See, honestly, there is no ideal scenario because it varies from person to person. Honestly, I'm saying this, because see, when you talk about someone's occupation, also, there are other occupational hazards. Then there is travel, then people falling ill, I fall ill. So it really, so what I say is life gets in the way of lifestyle. So if you as an individual can understand what this life keeps coming in between lifestyle, that is the most important thing. But if you tell me generically to break down lifestyle for a thyroid patient also, one is eat well. Chew your food thoroughly, keep your stomach clear. You should not have acidity, constipation, bloating, or minimum. Kabhi kabhi ho gaya is okay, but constantly popping antacids on should be avoided. Okay? Second is you must exercise. That is my toppest priority. So even if it is on a busy day, 15-20 minutes, on a good day, 40 minutes, on a very good day, 1 hour, at least 4 days in a week. Otherwise, ideally, at least give me 5 days in a week. So exercise becomes an important thing. Third is movement. Okay, you don't have time to exercise today. You're very busy today, but find reasons to walk around. Okay, if you keep sitting, it is going to accumulate belly fat. Okay, if it's going to accumulate belly fat, all issues are going to start. Okay, so you have to find reasons to move. Whether it's making your own bed, keeping your own plate, getting your own water, whatever reason you can find, but you have to move. Take the stairs, park far away, compulsorily walk inside the office. Even if you're sending an email, go to the colleague, talk to them. There are 101 ways to walk. We just have to be aware. Okay. Then you have your sleep patterns. Now, normally I do recommend try to sleep on the same day. That means before 12 in the night, you should be off to sleep. If that can happen, at least then what will happen is that 7 hours of sleep, 6 hours of sleep, 8 hours of sleep. So again, that can also vary from person to person. But even if I say 7 hours, so you are up at 7 a.m. So suppose someone is doing work at night, and if that same work can be done in the morning, that person will be more productive also, more efficient also. Okay. Of course, you're a night bird and you love sitting at night. That's a different thing. That's okay. But otherwise, you can try this so that your sleep rhythm, the circadian rhythm, they we call it, at least it is in place and not that you're sleeping at 2 in the morning. Of course, ideally is 10:30, 11 and all, but I also find that a little difficult. So at least I recommend that before 12 in the night, you should be off to sleep. Okay. And then stress. Now, unfortunately, stress is like an umbrella all over us, right? Okay. There is no way that a person will say, I don't have any stress in the world. There is no way. Okay. So the point is blaming stress for everything. Stress caused the thyroid, stress caused the diabetes. Yes, it might be true, but you are the one who is responding through that stress negatively. So if you can learn to understand what is stressing you, learn to manage it a little better. Of course, things like controlling, perfection, all these things, the person traits of a personality also become very intrigued when you're coming to stress, because that's how you respond to something. Now, Akshat might be able to let go of something faster. as compared to Akshat's wife. So even these changes, how long you hold on to something also makes a huge difference eventually to your habits. So if you work on these four pillars eventually, and then like I said, basic deficiencies need to be corrected, basic blood tests need to be done. So an annual checkup, especially if you're over 30, 35 years of age, it makes sense to do it. You can't be, you can be dealing with everything and suddenly you realize the TSH has gone up. That's a little unfair, right? Why have you not checked? And that is pulling you down. So take care of these five things, and hopefully, you will be able to be on track for the rest of your life with a few misses, but then you can come back on track. That's how it's going to be.
You're so positive, and thank you so much for taking time and answering all these questions of ours. Please follow both the accounts. I am Kavitha, founder of Tots and Moms. This is an organic food store where we cater to baby, kids, and moms' food requirement. The nutritious products that you can check on are available on our store. In this account, you can check. And Dr. Akshat makes amazing videos, lifestyle related, and all the topics that can be easily understandable, so relatable. That is why I felt very connected, and I wanted him to be on our session one day, and it happened so quickly. I'm really happy that our audience got a chance to meet him.
Thank you so much, Kavitha. Thank you so much for having me, and thank you so much, our beautiful audience, for actually sticking through us for 45 minutes almost.
Correct. Thank you, guys. This is Getting Saved. See you then. Bye. Bye, doctor.
Bye bye. Bye. Take care.